our patients. I'm also particularly proud for the time at HUMC, especially this year, actually 2025. It's already the Happy New Year, everyone. We made honor roll, top 20 in the nation, and #1 adult and children's hospital in the state. So congratulations to this team. This is truly a testament to the incredible dedication of our entire team. Nowhere is that dedication more apparent than throughout the hospital, starting with our emergency room, where our patients come in. The incredible team has been working especially hard in recent weeks and over the holiday season. As many of you know, in New Jersey has been facing one of the worst flu seasons in recent memory, and other respiratory viruses. The New Jersey Department of Health reports emergency department visits and outpatient visits, resulting in admissions, and multiple complications related to the flu have exceeded last season, especially predominantly in folks over 65 and over and younger kids. While the number of cases are getting better, this has tested our emergency departments across the state. Our teams have been on the front lines caring for our community members struck by the flu, as well as COVID and other respiratory viruses. Their resilience, their commitment to our patients during this surge is nothing short of heroic. Please join me in congratulating this team that continues to show up every single day, and our heartfelt round of gratitude for them. Congrats, guys, and thank you. I do want to be clear, despite these high volumes, our hospital remains a safe place. The protocols that the hospital follows, the staff, the masking, that all has ensures that we take care of our patients very, very safely. So you want the community to trust us and seek the care that they need. They are all committed to providing world-class care with one goal in mind, getting our patients healthy and back to their goals of life and back to their lives with their family. On the front lines of healthcare, we have a simple request. Let's focus on the facts. We want to make sure the community has the right information and they can make an informed decision. Vaccinations are simple yet profound act of protection, a shield for our children and our adults. I'm proud, if you remember, proud to have been the first employee of Hackensack Meridian Health to have received the COVID vaccine in December of 2020. I volunteered to demonstrate its safety and build trust with the community while offering hope. By choosing to vaccinate, we are honoring the scientific process, the facts, and making sure we build herd communities and we protect our community as a whole. We are a melting pot in this area. This safeguards the health and prevents complications. Dr. Joseph Underwood administered that very first vaccine, as you remember, to me right here at Hackensack University Medical Center, and I'm still—
Any tension there?
And I'm
No, none at all.
It was freezing. I remember that. And now I'd like to invite him up to share more on how we can all protect ourselves and our loved ones this season and well into the future. It is my pleasure to introduce our new Vice President and Chief Medical Officer at Hackensack University Medical Center and the previous Chair of Emergency Department, Dr. Joseph Underwood. Jeff? Please go ahead. All right, Jeff.
Thank you.
Doc.
Thank you, sir.
You can stand next to me. There's plenty of room.
Okay.
Thanks.
Please. Thank you, Dr. Tank, and good morning to everyone. I'd like to echo Dr. Tank's welcome and extend my own thanks to our distinguished guests, and a very special thank you to Congressman Gottheimer for his unwavering recognition for the hardworking men and women of our front line and for caring for our patients. Your support means the world not just to them, but it also means the world to us as well. Thank you. And so we're deeply grateful. As Dr. Tank mentioned, our teams have been under immense pressure, and it's important to understand the national context. This flu and cold season has seen activity explode across the United States, reaching record highs. For the first time since the CDC began tracking this data in 1997, flu or flu-like illnesses accounted for 8% of all visits to medical professionals in a single week at the end of December. Hospitalizations nationally have surged, driven in part by a new mutation of the common flu virus known as subclade K. Because this strain is new, our collective immunity is lower, which has contributed to its rapid spread. Sadly, the national trend has hit home as well. The New Jersey Department of Health recently reported the state's first confirmed pediatric flu death of the season. It's a heartbreaking reminder of how serious this virus can be. In the face of this challenge, our clinical teams do what they always do. They roll up their sleeves and they get to work. They sacrifice time with their own friends and families, especially over the holidays, to be here for our communities and patients. Their dedication is the bedrock of this institution, and we're profoundly grateful. The situation underscores a critical message we all have a part to play in. The most effective tool we have for preventing severe illness is indeed vaccination. Having witnessed firsthand the devastation of COVID-19 before a vaccine was available, I can say with absolute conviction that immunizations are the most vital tool we have to prevent suffering and to save lives. As healthcare professionals, it is our fundamental obligation to cut through the noise and ensure our patients' public have the facts. We must be trusted messengers who reaffirm that the science is clear. Vaccinations are a safe, proven, and essential tool to protect our children and our communities. We are actively putting this commitment into action through a multifaceted approach that included leading public awareness campaigns, providing community vaccine clinics for flu and COVID-19, and equipping our clinicians in hospitals, urgent cares, and primary care sites with the tools to have vital conversations that translate clear science into life-saving action. By getting vaccinated against the flu, COVID, and RSV, we can protect ourselves, our loved ones, and our communities, and help reduce the strain on our healthcare system. Thank you for your time today.
Please welcome to the podium Commissioner Rafael Marte.
Thank you very much.
See you, Ralph.
Thank you. Good morning, everyone, and thank you for being here. For those of you that don't know me, my name is Rafael Marte, and I serve as a commissioner for Bergen County. We're here today because this flu season is becoming more serious than what we've seen in recent years. Health officials across the country are reporting higher flu activity, increased hospitalizations, and growing pressure on healthcare systems. This is not something we can ignore. The flu is a serious illness. It can lead to complications such as pneumonia, hospitalization, and in some cases death, especially for older adults, young children, and individuals with underlying health conditions. The point of sharing this information with you isn't meant to scare you. It's something to educate you and hopefully encourage you and those around you to get your flu vaccine because it's the most effective way to protect ourselves and our community. Okay, sorry. Here. Bear with me. All right. Okay. I think we're here. Okay. In Bergen County, we are committed to making sure access to the flu vaccine is not a barrier for anyone. We are working to expand county-run flu clinics, partnering with local health departments, pharmacies, schools, senior centers, and community organizations, and ensuring clear, up-to-date information is available on where and how to get vaccinated. Our goal is to meet people where they are and remove obstacles necessary to ensure that our people are looking after themselves and getting their flu shot. We urge all residents to take this seriously, get vaccinated, encourage your family and friends to do the same, and help us protect our healthcare system in our community. This flu season, Bergen County is taking action And we ask everyone, every resident, to join us. Thank you.
Excellent. Thank you. Thanks, Commissioner.
Please welcome Acting Commissioner, New Jersey, Department of Health, Jeffrey Brown.
Hey, how are you? How are you, Commissioner?
Good, thank you. Good morning, everyone. I want to thank Hackensack Meridian Health and Congressman Josh Gottheimer for holding this important event. The Department of Health's mission is to promote healthy communities, protect public health, and ensure a high-quality health system. And access to vaccines is crucial to every piece of that mission. Vaccine access has saved countless lives, and it continues to save countless lives, as the other speakers mentioned, in this flu season, which is worse than last year's flu season, as you know, evidenced by our data and others. Vaccination is the best defense you have against severe illness and complications from flu. Unfortunately, at the federal level, over the last year, we've seen changes happen that are impacting access to vaccines. Central to this is the Advisory Committee on Immunization Practices at the CDC. They've diverted from evidence-based medical recommendations toward cherry-picked pseudoscience that creates confusion and put everyday people, especially our most vulnerable individuals, at risk. And these are not just my opinions. These are opinions that are echoed by every living CDC director across both parties since 1977 and most medical professional associations like the American Academy of Pediatrics. New Jersey is part of the New Jersey Northeast Public Health Collaborative, which is a voluntary group of state health departments, all focused on protecting public health. In fact, many states are releasing a statement today emphasizing access to vaccination, and I just wanted to read a piece of that. On January 5th, the acting director of the U.S. Centers for Disease Control and Prevention signed a decision memorandum that reduced the number of immunizations routinely recommended for all U.S. children. The authority to make vaccination requirements and recommendations, however, lies with states and appropriate jurisdictions, which is why emphasizing access to vaccination like today is so crucial. The change to the U.S. childhood vaccine schedule did not follow established procedures for vaccine recommendations. This change also creates confusions for families already trying to navigate a complex healthcare system, and sows doubt about the effectiveness of the science behind vaccines. Historically, the childhood immunization schedule has been updated regularly based on rigorous, expert-driven risk-benefit analysis of new data. These latest recommendations threaten to leave the American public, especially children, more vulnerable to preventable illness and death. The science is clear. Vaccines remain the best protection for keeping children and communities healthy. The vast majority of American adults and parents believe routine childhood vaccines are important for public health, as do we, and which is why, again, I want to thank Hackensack Meridian Health, who has partnered with the department to get vaccines into communities that need them, and a partnership that we intend to continue. And I want to thank Congressman Josh Gottheimer for emphasizing this and the announcements he's making today. So thank you.
Thanks so much. Thank you so much.
Please welcome Representative Josh Gottheimer.
Good morning.
Good morning.
Come on, come on.
Good morning.
Good morning. Happy New Year, everybody. It's wonderful to be back at Hackensack. I love coming here. You couldn't ask for a better hospital, and so I'm very, very lucky. And beyond the hospital itself and the care provided, the people are just off the charts, the best. We've got the best physicians and nurses and techs. You name it, we've got the best people here. So I just want to say thank you to such a great hospital. You heard the evidence of why they're great, you know, and other people have recognized it, but I just want to let you know that I've seen it firsthand, and I'm very grateful for them. So thank you very much. Thank you, Dr. Tank. Thank you, Dr. Tank. Congratulations on your newish role as Chief Hospital Executive. Dr. Underwood, thank you so much for your comments. Raphael, thank you so much for what you had to say and your leadership in the county. Of course, Acting Commissioner Brown, if you want to come up, there's room on the stage. We'd love to have you. Don't feel scared of these people just because they wear white coats. You can get one too if you want. But seriously, thank you for your leadership as well. It is great to be back here at Hackensack. As I said, it's one of the top hospitals in the country, and that's not by accident. It's making sure that they're on the front lines every single day, getting our backs, caring for our kids, our parents, and our grandparents. And part of getting our backs means making sure that we have good counsel and advice and on what to do. And that's part of why we're here today. What can we do to make sure that we stay safe this winter, this flu season? You heard some of the ideas, but I'll just tell you that I'm sure you know, if you look at what's going on in the schools or look at the hospital numbers or just talk to your friends and loved ones, the flu is crushing Jersey and crushing the country right now. The numbers have skyrocketed. I'll go through them in a minute. But it's miserable to get the flu, right? We know that, right? The coughing, the sneezing, the congestion, we know it can lead to pneumonia and other huge health challenges. It makes a difference if you get your flu shot, and we'll talk about that. If you do get the flu or you have flu-like symptoms, those fevers and coughs, Dr. Tank, what do we do again? If you feel that way, what should you do?
Call your doctor and see them as soon as possible.
Call your doctor, go to a clinic.
Yes.
Right?
Outpatient clinic, take your antivirals, and if you need us, we are here at the hospital too. But the key is stitch in time and really get to the doctor.
Get there fast, right? Because if you get those antivirals fast,
Yes.
it can make a huge difference.
It limits the flu and it limits the intensity of it.
Right, you get your antivirals like Tamiflu, right? Can limit the flu and the intensity and the duration. Getting the flu shot makes a huge difference about whether you're going to wind up in here at a hospital or not. So we'll talk about that in a second. This flu season is particularly deadly, as you heard, and we need more people to get their flu shots. Vaccines aren't a Democratic or Republican issue. They're just a what's good to keep healthy for your families and kid issue. There shouldn't be anything partisan or ideological about getting a flu shot. The government should not discourage children and families from getting flu shots when evidence-based science and doctors recommend them. Vaccines are about keeping people safe, alive, and protected. And right now, we are in the middle of one of the worst flu seasons we have seen in years. And it's hitting Jersey and our region especially hard. As of today, flu cases in New Jersey have more than doubled compared to this time last year, from about 5,500 cases to more than 12,000 cases already this season. The commissioner talked about what we're facing as a state and why it's critically important that we act. Hospitalizations are up more than 4 times from last year, from about 127 to more than 550. And remember, it's only the beginning of January. The flu also contributed to a major rise in absences in K-12 schools over the past few weeks. We saw this especially at the end of December. We're back at school now, so we'll see what these new numbers are. But as you know, kids get back together. They pass this on pretty fast. And tragically, as you heard as well just days ago, a young child here in North Jersey died from the flu. That is tragic. That's every parent's worst nightmare. It should stop all of us in our tracks, and it's why we must ensure that our children and our parents and grandparents have had their flu shots. Nationally, the Center for Disease Control and Prevention, the CDC, reported that the flu has already caused more than 15 million illnesses and 180,000 hospitalizations. That's across the country this season so far. 45 states are experiencing high to very high flu activity. Nearly 1 in 10 doctor visits nationwide right now are for flu-like symptoms, the highest level since tracking began nearly 30 years ago. Again, so these are the highest numbers in 3 decades. And yet, despite all this, only about 42% of Americans have gotten their flu shot this season. So you see the problem. We need more people to get their flu shots so that they don't pass it on to each other, so they stay healthier. And if they're exposed and get the flu, that will ensure that even if it's a different strain that was in the flu shot, you will still, right, that will make sure that the outcome is better than if you have not gotten the flu shot. Isn't that right, doctors? Right? Okay. Because people ask me that all the time. What about the strain that's not in the flu shot? If you get the flu shot at all, it will help you in your response and will reduce hospitalizations. Here in Jersey, about half of all flu cases have involved children, while most hospitalizations have been among those over 65. These are the people, though, we're supposed to protect the most, our children and our parents and grandparents. The CDC reported in 2024 that 90% of children who died from the flu were not fully vaccinated. So there is a correlation. So if you hear one thing today, hear this, please. If you have not gotten your flu shot, please go get it. Do it today if you can. If your kids have not gotten their flu shot, please take them to get vaccinated. And if you know someone who is older or immunocompromised, please help them get protected and find a place to get their flu shot. Because this is not just about you, this is about all of us. That's why today I'm taking action on several fronts, here at home in New Jersey and in Congress, to protect our families and help ensure more people can immediately get access to a flu shot. First, I'm introducing new federal legislation called the Fight Flu Act. federal investment in grants for health transportation, and Flu Vaccination Local Units Act. Simpler, the Fight Flu Act. This common sense bill will let states like Jersey claw back federal resources to create or expand mobile flu vaccine clinics, bringing shots directly into communities, to seniors, to working families, and to children, instead of making people jump through hoops to get protected. It's all about making life easier for people to get their flu shot, because people are busy. I get that. So we got to do everything we can to help make it easier for people to get their flu shots. People are busy, and you may not always get to see your doctor or go to a CVS or a Walgreens where you can get your flu shot. Getting a free flu shot should be easy as 1, 2, 3, in my opinion. No bureaucracy, no barriers. Right now, only a couple of counties in our state have mobile flu clinics, in Essex and Hudson counties. If access is the barrier, then we need to bring health care to people, not expect them to fight traffic, miss work, or skip care altogether. The Flight Flu Act is about improving access and making it easier to save lives and help get these mobile units out there. Second, I'm calling on the Bergen, Passaic, and Sussex County Health Departments, the counties that I represent in Congress, to deploy mobile flu vaccine clinics across northern New Jersey. If they don't have mobile trucks, I'm asking them to partner, please, with local hospitals to get units across North Jersey and protect our families. I know you're on it, and I know we're doing a lot already. The more we can do, the better. So thank you for all you're doing. If we can get mobile units out there, that'd be terrific. Third, I'm working with the state of New Jersey to ensure that they significantly ramp up their flu vaccine education program, which they're already doing great work on. That's why the commissioner's here today. It's not by accident. That's why he's been everywhere around the state, right? But the more we can do to focus on getting education out there for our families with young children and seniors, the better. People need to know the dangers and not buy into some social media disinformation campaign discouraging families from getting a flu shot or other critical vaccines like COVID-19 or the measles shots, right? These are basic things we should do to stay healthy. And I think this point's really important. It's not just about your own family's health, but it's of course about the health of other people. Right? If you have the flu, you could bring it to other people. Other people who are vulnerable, right? Or bring them other diseases, right? We know this from COVID-19. That's why we wear the masks, to try to make sure we do everything we can to stop the spread. The state already has great tools, information in multiple languages, community clinics, and no-cost vaccines for families who need them. But anything we can do to double down would be a good thing, and to do so urgently. When fewer than half of all Americans are vaccinated in this season, we have a problem that we all have to solve together. Our numbers in New Jersey are higher than the national average, which is a sign of the good work we're doing here in the state. But as you know, we can keep doing more to get those numbers up. Everyone right here in New Jersey needs to know that if you have insurance, you can get your flu shot for free at a pharmacy like CVS or Walgreens or your local pharmacy around the corner, or by booking an appointment with your doctor or a local clinic. If you don't have insurance, the flu shot is available to you for free through the Vaccines for Children of the 317 funded programs. You can find an eligible clinic on nj.gov. Is that right? /health, sorry. nj.gov/health. You can find a place where you can go get a free flu shot, correct?
Correct.
Excellent. You could do that right now. No family should skip a vaccine because they did not know where to go or thought they couldn't afford to get the vaccine. Finally, and this is critical, I'm fighting back against dangerous changes coming out of Washington that undermine vaccine confidence and put kids at risk. Shockingly, just last week, under this administration, Secretary of Health and Human Services Robert Kennedy slashed the number of recommended childhood vaccines, including vaccines that protected against the flu, COVID-19, RSV, hepatitis A, and hepatitis B, bypassing evidence-based medical experts' recommendations. Makes no sense. These routine vaccines have prevented nearly 2 million hospitalizations and more than 90,000 deaths in the past 30 years, according to the CDC. The new recommendations are not based on science, and as all of the CDC leaders, past ones, will tell you, by not being straight about this, it creates great uncertainty, confusion, and breeds conspiracy theories. A decrease in immunizations will lead to increases in childhood deaths and hospitalizations across the board. This is in addition to reckless decision to end universal recommendation of hepatitis B vaccine for newborns and to send mixed messages about the measles vaccine. And Kennedy and HHS did this without any evidence-based prompting the change. So I'm encouraging people, please, talk to your doctors, read the science, check out the evidence. please go get those vaccines. Measles is a highly contagious viral disease, for instance, that spreads through the air and affects the respiratory system. Before vaccines, it was a common and often serious childhood illness. Of all childhood illness diseases that cause fever and rash, measles is the deadliest. In 2025, there were a staggering 2,144 confirmed cases of measles, a 752% increase from the 285 cases in 2024, the highest confirmed cases of measles in more than 30 years. Just 2 doses of measles, mumps, and rubella, or the MMR vaccine, protects 97% of people from getting the measles. So you just go get those vaccines, and it helps ensure that you stay safe. But vaccination rates have dropped below what health experts say is needed to head off outbreaks. The 2025-26 flu season is on track, as I said, to be one of the worst in decades. It's already taken 17 lives of children across our country. Roughly 90% of children who died from the flu last year were not vaccinated. There's no evidence showing the flu vaccine causes harm to children, but overwhelming evidence that skipping it costs lives. That is vile, it's reckless, and unacceptable. And we should not allow that in our great state. Again, let me be clear as day. Politics and politicians should not overrule doctors. It's why I'm standing here with physicians and experts. Ideology shouldn't replace science. Last week, right after Kennedy's news on the flu and COVID-19 vaccines and other vaccines, I joined more than 100 of my colleagues in writing to the U.S. Department of Health and Human Services, demanding that they reverse the decision to gut the childhood immunization schedule and restore science-based guidance. I've called on the HHS to reinstate the millions of dollars in grants they cut to the American Academy of Pediatrics, aimed at supporting research on a number of childhood health diseases and initiatives. When Washington sends mixed messages, families get confused. And when families get confused because there's different messages coming at them, fewer kids get vaccinated, and that's what we're seeing right now. We don't want our children or our seniors or anyone ending up at hospitals like this one when we can easily prevent that. So please, I'm asking the administration, demanding the administration reverse course, restore the previous childhood immunization schedule, and put doctors and scientists, not extremists, back in charge of these public health decisions. Vaccines are one of the greatest public health successes in American history. They've saved millions of lives, lowered healthcare costs, and kept families whole. Undermining them doesn't make it safer, it puts us at risk. So today, standing here at Hackensack University Medical Center, I want to thank every healthcare worker out there who's working around the clock, fighting this flu surge head on. I want to thank every parent who's doing everything they can to do the right thing, getting their kids vaccinated. I will keep fighting for you, as I know the people on behind me and around here in this hospital will do, to protect science, to protect families, and to protect our great state. Protecting our kids is not controversial, nothing partisan. I want to say that again. There's nothing political about getting a vaccine for the flu. It should just be the thing we do to make sure we protect our kids. And if we listen to our doctors, look out for one another, and stand up for our children, I know in the greatest country in the world, our best days will always be ahead of us. Thanks, and God bless you, and God bless our great country.